Hello, my name is Brennan Monroe. I did my project number 4 on medical research, and my research was done on CTE. CTE, chronotraumatic encephalopathy, is one of the most researched brain disorders. It's highly variable and can come from multiple mild brain injuries to one severe brain injury or anything in between. Degeneration of the brain over time from high contact sports is what CTE is. Hockey, football, and boxing are common sports that have athletes with CTE. CTE is rare because it can only be diagnosed after death, so it is more common to go undiagnosed. Recognition. It is vital to recognize the symptoms of CTE while the recipient is alive. There's two main types of CTE. During your 20s and 30s, and it consists of mental instability as depression and suicide, and the other form of CTE is found to show up around your 60s and often consists of cognitive problems such as memory loss and dementia. In this presentation, I will be going over the components of CTE symptoms, athletes with CTE or that likely have or had CTE, and the prevention and treatment of CTE. Tau proteins. Deposition of these proteins found in the brain of CTE patients can be seen under a microscope during the autopsy of the brain. In one study, these proteins were found in 32% of 66 individuals with repeated head trauma, and in none of 198 individuals without this history of traumatic brain injury. Oxidization. Oxidative damage continues after original trauma. This damage injures the nerve tissue within these lesions created within the brain from a traumatic brain injury. This oxidative damage is believed to then lead to the tau protein deposition, which is found in the autopsy of brains and is how CTE is diagnosed during an autopsy. The symptoms of CTE. Cognitive impairments include memory loss and dementia. Behavior abnormalities include aggression, impulsivity, and paranoia. Mood disorders include depression, anxiety, and suicide. I'm going to go over a couple examples of famous athletes that have been found to have CTE or I think possibly have CTE currently. Aaron Hernandez was a famous football player. He received many hits to the head throughout his career. Hernandez was found guilty of a murder and sentenced to life in prison. Years later, he was found not guilty for a different murder that he didn't commit. Shortly after being found not guilty for the second murder, Hernandez killed himself in his prison cell. Hernandez's brain was autopsied and he was found to have CTE. Hernandez is one of the most famous cases of CTE because many believe that CTE led to Aaron Hernandez committing murder and later killing himself within prison. Nathan Stiles is the youngest athlete to ever be found with CTE. He was only 17 years old when he received a concussion playing football. Shortly after receiving this concussion, he returned to play and got another concussion, giving him second impact syndrome. Stiles later died at the hospital due to the second impact syndrome. They autopsied his brain and found he had CTE. This is concerning because it shows CTE can be developed at young ages. This makes me wonder how many athletes are currently playing high contact sports with CTE. Muhammad Ali. Muhammad Ali is one of the best boxers of all time. Obviously, because he is a boxer, he got hit many times in the head. When Muhammad Ali was older, he developed Parkinson's disease. Studies show that boxers have an increased risk of Parkinson's disease and dementia. I believe this is related to CTE. Ali's brain was never autopsied for CTE, but many believe he developed Parkinson's due to the repeated blows to the head. Antonio Brown. Antonio Brown is still alive, so it cannot be proved that he has CTE. Brown no longer plays in the NFL. Brown is known for taking many traumatic hits to the head. I think Brown has CTE because throughout his career he became extremely impulsive during doing things such as leaving the stadium mid-game and quitting football. This is Antonio Brown, and here's a video of some of the hits he took to the head. Antonio Brown received many other hits like this early in his career, and later in his career, this ended up turning into he ended up developing mental problems that he struggled with, and he's now no longer playing. Prevention, diagnosis, and treatment. CTE can only be diagnosed with an autopsy of the brain observing the pattern of tau proteins. This makes treatment of CTE challenging because you can only guess if a person has CTE symptoms based off the symptoms they exhibit. Some treatments for CTE symptoms include therapy and memory exercises. The best way to prevent CTE is to avoid hits to the head and use proper head protection. This can be difficult in high contact sports, but learning the proper ways to brace for an impact can help. It is also extremely important to follow the return to play protocol after head injuries. Overall, CTE has become more well known, but it is still an emerging topic and needs more research. I researched my sources on NHS, Concussion Foundation, and Mayo Clinic, and I looked at CTE articles on those three websites. And then I looked at a website with the 20 big NFL cases of CTE, which is where I found some of my examples. Thank you for listening. Any questions?